Hey everyone, Brahm here. Welcome back to the Human 3 podcast. I don't know about you, but lately it has started to feel like psychedelics are back on the menu. If you guys remember my channel back in 2021, psychedelics was really the first thing that I started covering. In fact, my video about MindMed, which was called MindMed Pump and Dump or To the Moon, was really the first video that got any sort of response and really inspired me to keep making videos and podcasts. And that eventually led to me starting a venture capital fund that was focused on psychedelic medicine and eventually expanded to invest in things outside of psychedelics. So psychedelics has always been kind of like, and investing in psychedelics specifically has always been sort of core to what I do and what this channel has done, at least, since 2021. But from 2023 to 2024, there was a real significant lull in the psychedelic space. I mean, all of the publicly traded companies, Compass Pathways, Cybin, ATAI, pretty much all of them just cratered during that time period. On the private market side, there weren't any new psychedelic companies being formed. Back when I started looking in the private markets from a venture perspective in 2020 and 2021, it seemed like every day there was a new company being formed that was going to revolutionize psychedelics in some way. And I was getting like at least a new pitch deck every single day talking about companies that were doing this. And then in the middle of 2022, when interest rates started rising and the market started slowing down, I stopped seeing new psychedelic companies being formed. And it was really just kind of a depressing period. There was nothing exciting happening. None of the companies were putting out any significant research. The prices were tanking and people started focusing on other things like AI, and psychedelics really just kind of, it seemed like it died. And then something happened just in the last few months, really. I think it might have kicked off in January of this year when GH Research released their big study on 5-MeO-DMT for treatment-resistant depression and showed that incredible efficacy rate, that 15-point difference on the depression scale between folks in the active group versus the placebo group, that people started to pay attention to the psychedelic world, the psychedelic for-profit, the psychedelic pharmaceutical world again. You can add to that, obviously, the things that are going on in the administration with RFK and Trump, which love them or hate them. It is interesting to see that level of vocal support from the seat of political power in the country. You just really can't deny that that's something that we've never had before. So you get that political support, you combine it with first that GH study, then the the Compass phase 3 study that just came out a few weeks ago. And you see these big numbers like $500 million being thrown around. That's what Cybin just secured in commitments for future financings. And you see things like Spravato, Johnson & Johnson's ketamine drug, just surpassing a $1.6 billion annual revenue run rate, which is crazy. It's the one FDA-approved psychedelic. And when it started out in 2019, when it first got approved, it was just making, pennies. I think it was like 40, 50 million the first year. And it's grown from that over the last 5-6 years to, over 1.6 billion. It's insane. And so people are starting to pay attention to psychedelics again. And it feels like I said, they're kind of back on the menu. So for this podcast, I just want to talk about a few things that I've seen in the psychedelics market lately. But this is in some ways a sort of teaser for a live podcast /webinar /workshop. I don't know what term you want to use for like a live internet event that my partner Samantha and I, who's normally my co-host on this podcast, we are hosting tomorrow, July 31st, right? July 30th. What am I talking about? It's late here. July 30th at 11 a.m. Pacific Standard Time. We are going to talk about what we have learned allocating to both the public and private psychedelics markets over the past few years, how our views have changed, our views on the traditional psychedelics versus the second and third generation psychedelics, our view on sort of state level and even federal level legalization versus pharmaceuticalization, the best place for people with capital that they want to allocate to the space to look if they're kind of starting now. And we're doing this in this sort of like webinar / live podcast format because we know that this kind of stuff really generates a lot of interest and questions. And we feel like it's much more efficient to answer them in a live format rather than record a podcast, wait for people to like send questions and then like try to respond to them. So anyway, all that to say, July 30th, which is tomorrow at 11 a.m. Pacific Standard Time, West Coast time, we're doing this webinar. If you want to join so that you can interact with Samantha and myself, and you want to ask us questions about psychedelics, you can go to psybio.org. That is PSYBIO.org, and just sign up there. I think we have like 120 people signed up already, so should be a pretty full house. Even if the majority of people don't come, there'll still be enough folks to keep it interesting. So hope to see you there, psybio.org. All right, a few things that I've seen recently in the psychedelic publicly traded markets that are worth commenting on. You guys will probably recall that at the end of June, I believe it was June 20th, Compass Pathways, which is developing psilocybin to treat treatment-resistant depression, they released a top-line readout from their phase 3 study. It's just a top-line readout, not the full study, and it was a positive readout. It showed that the difference at week 6, so 6 weeks after the person got their single dose of psilocybin, the folks in the active group, the people that actually got the psilocybin, when you compare them to the folks that got the placebo, the people that received the actual psilocybin, their score, their depression rating on average decreased 3.6 points more than those in the placebo group. So this is the MADRS score, which is the clinical gold standard for measuring any sort of depression. And it was a statistically significant decrease. And it was actually kind of on the same order of what Spravato got in its trials before it got approved. And again, Spravato is that ketamine drug that Johnson & Johnson is making $1.6 billion a year on. So it was a statistically significant result. Spravato, when it got approved, was like a 3 to 4 point differential. This Compass Pathways drug was a 3.6 differential. You would think that would make people excited, but the stock dropped 50%. And the next day, Sam and I did an emergency podcast and we talked about this. And our view then was that people, because psychedelics get so much hype, I think they were expecting some crazy blowout number, like a 10-point difference or something, which would have been great. But a 3.6 point difference between active and placebo group is still very significant. And if you're someone that is suffering from treatment-resistant depression, for which, by the way, there are only like 2 or 3 approved treatments, this is going to be a big deal for you. And we felt that 50% sell-off in Compass was a major overreaction. And I think we predicted on that podcast that the stock would probably rebound. And sitting here today, the evening of July 28th, I think it is, the stock has rebounded. So here's how this went. It was $4.80 per share on June 20th, the day before that data came out. It dropped to $2.35 per share, which is about a 50% drop. And as of today, it's now back to $4.40. So it went from $4.80 to $2.35, back to $4.40. So now it's only about down 8% compared to where it was before that study came out, proving our hypothesis or our prediction that the stock was going to rebound because that sell-off was a major overreaction. So if there's a lesson there, I think it's that with psychedelics, people, it's almost like psychedelics get held to this impossible standard where if they work well in a statistically significant manner, it's almost like that's not enough. Because they're psychedelics, they're these magical things, they have to work like extra super duper well. And at least that's maybe the mindset of a lot of the retail traders who dumped their shares after the study came out. But it turns out that from a clinical perspective, if you are delivering a statistically significant decrease in depression to a population that doesn't really have any other options with a single dose of a drug, which is what the Compass Pathways drug is dosed as, it's a single dose, whereas Spravato requires, every 2 weeks. That's a massive accomplishment. And if anything, the stock should rise, assuming it gets approved, of course. But based on the data that we do have, it does seem like it was a solid result. And I think the markets are starting to kind of realize that. Okay, the next thing I want to talk about real quick is this news from ATAI Life Sciences. ATAI is everyone's favorite psychedelic company. It's got this, I also did a video on ATAI back in the day, which was fun and got a lot of attention and feedback, including from some folks that worked at ATAI. ATAI has this hub and spoke model, which is where there's the holding company, which is ATAI, and then it has these little subsidiaries or spokes Each of those subsidiaries is focused on a specific therapeutic area or asset type, and most of the spokes of ATAI are focused on something related to psychedelics. In fact, Compass Pathways was once a subsidiary or spoke of ATAI, and then it got spun out via IPO. One of ATAI's spokes last Friday, just over this past weekend, released some data on a drug that was not psychedelic. This is kind of a weird, out-of-character thing for ATAI. It's one of their few spoke companies that is not psychedelic-focused. They were running a trial for a drug that was aiming to treat cognitive impairment in patients with schizophrenia. This is a disease that does not have any FDA-approved treatments or cures. And the drug released, well, I'll just read from the press release here. It says, initial results demonstrate numerical improvement of cognitive and functional measures with inidascamine, that's the name of the drug, across both active treatment arms compared to placebo. So that sounds good. And here's the bad news. But they did not meet statistical significance on the primary endpoint. So the data did show some improvement, but it was not statistically significant. And ATAI dropped, I think it was like 8 or 10% in after hours trading because of that news. Probably would have dropped more, but Recognify, the subsidiary, is a pretty small part of ATAI's balance sheet. So, it's probably not that big of a deal in the grand scheme of things. And it's kind of interesting because this drug, again, this is not a psychedelic drug, and ATAI is primarily focused on psychedelics. And the history of this drug is kind of interesting and is just sort of like illustrative of the type of thing that happens in big pharma all the time, where these drugs just kind of like wander from company to company and don't seem to make much progress. This is the backstory of this drug. It was developed in Allergan, which is a big pharma company. And then it was, I think, shelved, and it was licensed by this startup called Recognify. And at the time, the drug was initially developed to treat, I think, neuropathic pain. It was a pain-related indication. And it was actually in phase 2 trials for this neuropathic pain. And during the phase 2 trial, in addition to collecting the primary endpoint, which is like the improvement on the neuropathic pain score, they were also collecting these experimental endpoints related to cognitive function. And I guess they saw that this drug had these interesting cognitive boosting effects. And at some point, a decision was made, exactly for what reason, I'm not totally sure, but they said, let's forget about this pain stuff and let's just refocus this drug as a treatment for cognitive impairment. And then from there, they somehow decided that cognitive impairment in schizophrenic patients was the area that they should focus on. Maybe because they figured that this was like an orphan indication, no one had ever developed a drug for it. And so it made sense that it would be kind of easy to get approval because there was no existing treatment. So I thought that was, it's just so interesting that a drug that is treating pain could also potentially treat cognitive impairment. And then it's interesting how these drugs just make their way from these big pharmaceutical companies to these new startups. And then ATAI ends up making a controlling investment in Recognify back in 2021. And then it becomes part of the ATAI umbrella. And then after this result on Friday, Christian Angermeyer, who is the chairman, I don't think he's the CEO, the chairman of ATAI, he tweets, non-psychedelic strategic investments like inidascamine and etoxaphene will either be divested, spun out via IPO, or developed exclusively in partnership with pharmaceutical companies. The future is psychedelic. And that kind of goes back to what I was saying at the beginning of this video, which is that it really feels like psychedelics are kind of back on the menu and back at the center of the stage. It seemed like for a while, even the companies that were still operating in 2023 and 2024 that were doing work in psychedelics almost like tried to downplay the fact that they were working with psychedelics, and they would start saying things like, we're actually a neuropsychiatry company or a neuroplastogen company or a psychoactive pharmacology company. They would do anything to get away from using the word psychedelic, even if what they were building or working on was psychedelic. And now you see it right here. Christian's like, not only are we downplaying our non-psychedelic stuff, we're spinning it out, we're divesting from it, and the future is now psychedelic. And that is just one example of this sentiment that I've been noticing. Maybe it's just me, but it feels like it's real. And that's why we decided to do this live podcast webinar workshop thing that we're doing tomorrow, again, July 30th at 11 a.m. Pacific Standard Time, which you can sign up for at scibio.org, because I think that there are a lot of folks that have capital that maybe missed the initial psychedelic wave in 2020 and 2021. And, maybe they're new to the space and they just don't have the same foundation as someone who maybe watched some of those videos that I made back in 2021 did for the space. And so this is going to be a easy way for someone to come to the space and leave with a nice foundational view of what is the motivation for psychedelic therapeutics and psychedelic biotech. What are the different types of psychedelics? What is a non-hallucinogenic psychedelic? What is the timeline before psychedelics get approved? What does it look like to deliver these things in a clinical care setting? What are the different dimensions along which one should analyze a psychedelic biotech company? And of course, how can one get involved in investing in psychedelics? So anyway, if that's you, or if that's not you, but you would still be interested in learning about that stuff anyway, scibio.org, psybio.org. I'll see you there.